Imagine spending years searching for answers to your child's mysterious medical condition, only to be met with silence and uncertainty. Now picture the moment a team of experts cracks the case that stumped everyone else. This is exactly what the Indiana University Undiagnosed Rare Disease Clinic is doing, transforming baffling medical mysteries into empowering answers for families, and giving fresh hope to patients that modern medicine often overlooks. But here's where the story takes a surprising twist. When Madison Hardman was born, her family quickly realized her journey would be anything but normal. Feeding struggles, slow advancement in basic milestones, and by her third birthday, she was still not talking or walking independently. Doctors suspected a genetic disorder, yet intensive rounds of tests, blood work, scans, even DNA analysis yielded nothing. Like thousands with ultra-rare conditions, Madison's future seemed shrouded in uncertainty. And this is the part most people miss. For families like Madison's, the emotional and logistical pull of searching for a diagnosis is immense. Hope often weaves in and out, fueled by yet another round of testing, only to be dashed again. Imagine the frustration. Another doctor's visit, another inconclusive result. Madison saw at least 10 specialists, but no one could give her family clarity. Her mother, Sarah, called their visit to the IU clinic a last-ditch effort, the place they trusted with their final hope for answers. Launched in 2020, Indiana University School of Medicine's Undiagnosed Rare Disease Clinic has become a beacon of last resort for families throughout Indiana and neighboring states. What makes this clinic unique? Not only is it part of the prestigious, federally funded Undiagnosed Diseases Network, one of just 24 in the nation, but it's also Indiana's only official center of excellence for rare disorders, a recognition from the National Organization for Rare Disorders. Dr. Erin Conboy, a leading clinical and metabolic geneticist, shares that most of their patients have already endured a lengthy diagnostic odyssey. They've had the most advanced genetic tests available, but when there's still no answer, that's when we step in, she explains. It's here that complex, seemingly unsolvable medical cold cases are cracked. So how do these expert detectives do it? The clinic's co-director, Dr. Francesco Vetrini, compares their approach to detective work, analyzing direct and circumstantial evidence and looking for the elusive smoking gun, the genetic variant that finally solves the riddle. The most exciting moment, he says, is telling a family, "We found the answer. Here is the gene mutation causing your loved one's condition." Let's pause for a second. The diagnosis alone doesn't always mean a cure or a radically new treatment path. Is finding out what's wrong truly enough? For many families, just having an explanation lifts an enormous weight, brings closure, and can unlock support such as better insurance coverage or access to government programs. Sometimes it also clears the way for innovative therapies down the line. In Madison's breakthrough moment, whole genome sequencing, the most comprehensive type of genetic testing available, uncovered uncommon variants in the DOC3 gene, inherited from both her parents. When her first genetic tests were run, the science wasn't there yet. Nobody knew that DOC3 errors could cause the kinds of symptoms Madison experienced. Now, thanks to her case, she's part of an extremely exclusive cohort. Children diagnosed with DOC3-related neurodevelopmental disorder, a syndrome that leads to intellectual challenges, poor muscle tone, and coordination problems. Her story is helping medical experts around the world learn how this ultra-rare disease unfolds over time. Sarah Hardman always believed her daughter was destined for something special, despite the hardships. She's become part of something bigger, Sarah reflects. Madison's kind-hearted and empathetic nature shines through. She's a big fan of music, from Prince to Taylor Swift, and loves encouraging others. Knowing the cause of her challenges, even if her daily life hasn't changed, has brought the Hardman family solace. Sarah will never forget the emotional moment when genetic counselor Kayla Treat shared the news. "We have an answer." Overwhelmed, she broke down in tears. Finally, someone could explain what had felt unexplainable. This victory required an all-hands-on-deck approach. The IU Genome Board, a diverse team of geneticists, counselors, laboratory experts, analysts, postdocs, and more meet regularly to tackle these unsolved cases. They often collaborate on a global scale, using platforms like GeneMatcher to connect with other scientists chasing solutions for the same rare genes. But here's the controversial question. If medical knowledge about our 20,000-plus genes is still so limited, of those, scientists only understand the function of about 7,500, how many other Madisons might still be waiting for their breakthrough? Dr. Vetrini emphasizes that their process is never truly finished. Cases are re-examined as new research emerges, ensuring families always benefit from the latest science. Persistence, he says, is the secret ingredient. Sarah sums up the journey best. Everyone at the Rare Disease Clinic has been so caring and patient, answering our questions as we learn about Madison's diagnosis. They're learning alongside us. Does Madison's story inspire hope that more rare disease cold cases can be cracked? Or is it also a sobering reminder of how much we still don't know about genetics? Should there be even more focused investment and global collaboration to close this knowledge gap? Share your thoughts, questions, and even your disagreements in the comments below. After all, it's often the most challenging questions that drive science forward.